Could your own legs be driving you to the brink of insanity? It sounds like a strange question, but for millions of people, it is a nightly reality. Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. Today, we are delving into a condition that is profoundly misunderstood, often misdiagnosed, and can cause unimaginable suffering. It's called restless leg syndrome. And it is absolutely crucial that you stay with me until the very end, because I will be sharing several simple, powerful strategies you can use at home, starting tonight, to find relief. Tips that could make a world of difference before you even step foot in a doctor's office. So what exactly is restless leg syndrome? The name itself sounds almost trivial, doesn't it? Restless legs. But I want to assure you, this is anything but trivial. I have had patients come to my practice with suicidal thoughts, all stemming from this condition. It can be so severe that it entirely robs a person of their ability to sleep, to rest, to live a normal life. Let me paint a picture for you. Imagine you're settling down for the evening. The day is over and you're ready for peace. But just as your body begins to relax, an almost indescribable sensation begins to build in your legs. It's not quite pain, not quite a cramp. My patients have used many words to try and explain it. Worms crawling under my skin, an electric current, a fizzy, bubbling feeling, or simply an overwhelming urge to move. You can't articulate it, but it's intensely unpleasant, and the only way to get a moment of relief is to move your legs. You shake them, you stretch them, and for a few seconds, perhaps a minute, the feeling subsides. But then, as soon as you are still again, it comes creeping back, wave after wave. Now, imagine lying in bed, trying to fall asleep, but being forced to constantly move, to get up and pace. We have conducted sleep studies, and I've seen it firsthand. I've watched a patient, covered in sensors, unable to even lie in her bed. She just walks, back and forth, for hours. I had one patient whose fitness tracker showed he walked 20 kilometers, over 12 miles, in a single night, just pacing around his neighborhood because the sensations would not allow him to rest. And even if exhaustion finally takes over and you do fall asleep, the problem doesn't end. Your legs may continue to twitch and jerk periodically throughout the night, often every 20 or 30 seconds. Each movement sends a tiny signal to your brain, pulling you out of deep restorative sleep. It's like someone is gently tapping on your brain's door all night long, saying, "Wake up, wake up." You might not be fully conscious of it, but you wake up in the morning feeling exhausted, as if you haven't slept at all, only finding true rest in the early morning hours when the symptoms finally subside. The great tragedy here is that for decades, this profound suffering has been dismissed or misdiagnosed. A person goes to their doctor and says, "Doctor, my legs feel strange at night. I can't explain it." If the doctor hasn't been specifically trained in sleep medicine or neurology, and tragically, many have not, they don't recognize the pattern. They might think it's a problem with blood vessels or joints. They run tests, scans, and find nothing. When everything comes back normal, what happens? The patient is often told it's all in their head. I remember one particular patient, a grandmother, whose story perfectly illustrates this tragedy. Her symptoms first began in 1944, as a teenager. We didn't give her the correct diagnosis until 2008, when she was in her late 70s. For over 60 years, she suffered. She had veins surgically removed. She had injections in her joints. She was sent to spas for radon baths. Nothing worked. Eventually, she was sent to a psychiatrist. She tried to explain her symptoms. "Doctor, it feels like worms are crawling under my skin and it keeps me from sleeping." What does a psychiatrist, who isn't thinking about a neurological movement disorder, hear? They hear tactile hallucinations. The logical treatment for that is an antipsychotic medication. But here is the cruel, devastating irony. That entire class of drugs works by interfering with a brain chemical called dopamine. And as we now know, restless leg syndrome is, at its core, a problem with the dopamine system. So the very medication meant to help her was like pouring gasoline on a fire. She told me, "Professor, I would take the medicine and it would get so much worse." Her doctors would say, "The disease must be progressing. We need to increase the dose." It became a nightmarish cycle. The only relief she got was when she would stop the medication on her own, to everyone's confusion. This is not a problem with your legs themselves. It is a problem with the brain's biochemistry, specifically the regulation of dopamine, a neurotransmitter that controls movement and pleasure. So how do we know if this is what you're experiencing? The diagnosis is actually based on a clear set of clinical signs. First, that overwhelming, often unpleasant urge to move the legs, usually accompanied by strange sensations. Second, the symptoms begin or worsen during periods of rest or inactivity, like sitting or lying down. Third, the symptoms are partially or totally relieved by movement, such as walking or stretching, for as long as the activity continues. And fourth, the symptoms are worse in the evening or at night. This is a key clue. In the evening, your brain starts producing melatonin to prepare you for sleep. Melatonin naturally suppresses dopamine. If your dopamine system is already struggling, this nightly drop pushes it over the edge and the symptoms erupt. The good news in all of this is that once a doctor knows what to look for, the diagnosis is straightforward. It's a condition that is easy to recognize, but only if you know it exists. So, what do we do about it? First, a proper diagnosis begins with a thorough conversation. Next, we run a simple blood test to check your levels of iron, and most importantly, ferritin. Ferritin is a protein that stores iron in your body. Think of it as your body's iron savings account. The transport of iron into the brain is crucial for producing dopamine. Your iron level might still be in the normal range, but your ferritin could already be depleted. And here's a critical piece of information. For a person with restless leg syndrome, the standard normal range for ferritin is not good enough. All modern clinical guidelines recommend a ferritin level above 75. A level of 20 or 30, while technically normal for a healthy person, is simply not adequate in this situation. For my grandmother patient, the one who suffered for over 60 years, treatment was life-altering. After confirming the diagnosis, we gave her a small dose of a medication that stimulates dopamine receptors in the brain. The next morning, when I came to see her, she burst into tears. I asked her what was wrong. Through her tears, she said, "My dear, I slept through the entire night for the first time in my life. I feel like I've lost a lifetime." In that moment, you understand the devastating toll of the disease and the profound power of a correct diagnosis and treatment. She wasn't a frozen image on a video monitor. She was a person, finally at peace, sleeping soundly. Now, these medications are powerful and must be managed by a qualified doctor, as they have side effects and require careful oversight, but they demonstrate just how treatable this condition is. And now, as promised, let's talk about what you can do, starting today. These are the strategies that can bring significant relief. First, based on what we just discussed, ask your doctor for a blood test to check both your iron and your ferritin levels. Be your own advocate. You can even say, "I suspect I may have symptoms of RLS, and I've learned that my ferritin level should be above 75. Raising your iron stores under a doctor's guidance can sometimes be enough to resolve mild cases entirely. Second, completely eliminate caffeine. We often drink coffee and tea throughout the day, even in the evening, without connecting it to our nightly struggles. Caffeine is a powerful nervous system stimulant that can severely worsen RLS symptoms in susceptible people. Try a strict 2-week detox from all caffeine, coffee, tea, soda, chocolate, and observe what happens. You may be shocked at the improvement. Third, change your pre-sleep routine. Remember, the symptoms are triggered by rest. Therefore, don't go from sitting on the couch for 2 hours straight to lying down in bed. Just before bed, take a gentle 15-minute walk, do some light stretching. By keeping your legs gently active right up until you lie down to sleep, you can often bypass the onset of the symptoms and drift off to sleep more easily. Finally, there's what we call distraction therapy. It has been observed that when a person is deeply mentally engaged in something, like playing a card game, a video game, or chess, the symptoms can vanish. This isn't just a mental trick. These engaging, often pleasurable activities also activate the dopamine system in your brain, which can help to normalize the signals and quiet the symptoms. So, if you're stuck on a long flight or a car ride and feel the sensations beginning, engaging your brain with a puzzle or a game can be a surprisingly effective remedy. This is a real, serious, but ultimately manageable neurological condition. You are not imagining it, and you do not have to suffer in silence. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.